Hello, my name is Jasmine and this is my friend Cynthia. Today we will be doing a video presentation about bronchoscopy. In our video presentation, I will be playing the role of a hospital unit clerk and Cynthia will be my simulated client. For this video assignment, we will be discussing about what is bronchoscopy, what is the purpose of this test, how long is this test done, and is there any medications involved? Are there any preparations for the test? As well as, is there any risk? And is there any aftercare instructions? Those are the questions that will be answered in our video. And we will commence it in 3, 2, 1, start. Hi Cynthia, how are you doing today?
Good, how are you?
I'm very well, thanks for asking. How can I help you today?
I'm having a bronchoscopy test and I don't really know what is that.
Oh,
Can you please explain in detail what the test is all about?
sure. So bronchoscopy is the process of viewing or examining the person's airways and lungs with the use of a scope.
Scope? What is scope?
Bronchoscope. So bronchoscope is the instrument used to do this procedure. There are two types of bronchoscope, flexible and rigid bronchoscope. A rigid bronchoscope is a straight tube that is used to view the larger airway. A flexible bronchoscope is a long thin tube that is more commonly used than a rigid bronchoscope as it is more comfortable for patients and provides a better view of smaller airways.
What is the purpose of this test?
The purpose of this test is to examine the airway, to evaluate bleeding in the lungs, chronic coughs, collapsed lung, and lung cancer. This test is also being used or done to remove foreign objects and open spaces that may be blocking the airway.
How is this test done?
During the procedure, the scope will be inserted to the nose or mouth, down the throat, past the vocal cords, through your trachea or windpipe, and into your bronchial tubes as the provider examines the lining of your airways with care.
How long does the test take?
The test is fairly quick, usually lasting around 30 minutes.
Are there any medications involved?
There are medications involved that may be needed for sedation, but your provider will explain to you in details about the medications which will be used for this procedure.
Is there any preparation for the test?
Prior to the test, you may need to do some fasting as directed by your physician. You must also inform the doctor of any allergies and current medications you are taking in case there are any interactions with the procedure. You may also prepare a transportation ahead of time or have someone be with you and drive you home after the test as the effect from the sedations may be lingering from your body.
Are there any risks?
I'm sorry?
Are there any risks?
Oh, so the bronchoscopy is very safe for most people. However, like any other medical procedure, there are some risks involved. These risks may vary on your general health and other factors. It is best to ask your healthcare providers which risks will most likely apply to you.
Are there any aftercare instructions?
Yes, your provider or doctor will give you more specific instructions about the recovering from this procedure. But if by chance you experience coughing up blood, severe chest pain, difficulty breathing, you must seek medical advice right away to ensure your health safety. And just to remind you, prior to doing the test, one of the preparations that you could also do is to have a advanced care planning or personal directive ready if you have one available, as it is it's best to have it ready and bring it to the hospital, bring the documentation to the hospital prior to the test.
Thank you so much for the information. You've been very helpful. I really appreciate your help.
You're very welcome. Thank you. Have a great day. Now that we have some information about the bronchoscopy, let me conclude by saying some important things. In order to book bronchoscopy services, the pulmonary diagnostic clinic will need to be contacted. Some tasks that will need to be completed by hospital unit clerk for the assigned procedure is to obtain a signed consent form from the patient prior to the procedure and the sedation. The HUC must complete a requisition form and transcribe and process the order. The HUC must also book porters as needed and print and place a preparation card in the client's chart. Moreover, the HUC must communicate pertinent information to the testing department. For example, if a client has physical or cognitive impairment or any other significant medical information, it's best to communicate it with them. Also, if there is any language barriers, allergies, and histories of seizures. Aside from communicating with the nursing staff and on with the staff on the unit and diagnostic department, the HUC must also contact the other departments such as portering department, if client needs to be portered, as well as the attire department if clients needs to remain NPO for an X amount of time. To conclude, we must keep in mind that diagnostic testing plays a significant role of health promotion and disease prevention, as these tests screens for diseases, discovers problems early, and facilitate an early treatment. Thanks for watching the video.